Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Well, hello, Dr. Swain. It's so good to see you.
Hey, Stacy. It's good to be back. I'm ready for season 2.
I know. We have not spent some time together in the studio for a little while, and now we're getting ready to kick off season 2 of the Swain Sinus Show.
Well, I'm glad to be here, and I wanted to start the season off by talking about some of the disappointments or frustrations that people can have when they have chronic sinusitis and have sinus disease. A lot of times it's really about managing people's sense of expectation about what's going on. So many times people come in and think, hey, I'm going to have an operation. You know, I've been on these antibiotics. I've been on these steroids. I'm going to have an operation and it's all going to be fixed. The page is going to turn. I'm going to start a new chapter in my life and it will all be over. And for some people, that is the case. An operation will dramatically change things. But in other folks, it gets to be more complicated. You know, we were talking before the show a little bit about the fact that the human body is so complicated and it's not so simple sometimes as taking something out or replacing a part. You know, the analogy that I use all the time is, you know, having your appendix taken out or having your tonsils taken out. If you have bad tonsillitis and we take out your tonsils, no more tonsils, no more tonsillitis for the most part. Mm-hmm. Or if you have if you have an appendicitis and you need your appendix out and you take the appendix out, well, no more appendicitis. We can't take your sinuses out.
Well, I do remember in our first episode, I believe it was episode 8 or 9, when we talked about, but sinuses are a system. There are multiple sinus cavities. So it's not like you go in and, like you said, you can't just remove the sinus. You can't just fix one sinus. It's a whole system. And so therefore, that makes it more complicated by nature, right?
Yes and no. You know, the sinuses are it's an anatomical area, but the inflammation of that area, you're correct. They're all connected. They all have drainage pathways that have common outflow tracts. All the sinuses drain down the back of the throat and and then you swallow those secretions. So it's a very narrow space with a lot of complicated anatomy. Mm-hmm. And so we don't have the ability to take those out. We certainly can do things in bad situations if there's a tumor or something like that where we can destroy the sinus. But for most folks, that's not an option. And how we address some of the inflammation, some of the things that people have, it can be varied, and it's all individualized, really. But a lot of times people will come in, you know, they don't have a sinus tumor or something like that, but they've had sinus surgery or they've had polyps or they have chronic inflammation or they have allergies and they've had surgery and they've been on allergy shots and they're just not better. And so what do you tell those people? And that's kind of what I want to talk about this show is, first of all, there's always hope. You know, it's never the fact that, oh my gosh, I've got this going on. There's no hope. We aim to try to give people a better quality of life, to give them more good days than bad days. And in some people, you can't give them a cure. I mean, chronic sinusitis is called chronic for a reason. Right. It's chronic and it's a condition and it can give you all kinds of symptoms and you don't feel good and you don't have a good quality of life, but there are other things that can be done. And it's a question of when people come in and they're in one of those groups where they've had surgery, they don't feel like they've done well. How do you go about counseling them and what do you do to try to make it better?
It seems like you would spend a lot of time with patients setting those expectations. Tell me about those who have had surgery and are coming to you maybe as a second or a third doctor. How do you work through some of their probably anxieties that they have around having surgery again?
Well, I think that's a really good question, and the answer is I don't have a standard set answer for that. I think you have to listen to what people are saying. And then, we always want to get some images. Usually want to look in the nose and see. And a lot of times if the CT scan shows that there's some areas there that need to be addressed, either with surgery or medicines, we'll address those. And sometimes you have to look at people and say, look, you've had good surgery. This is not a surgical problem. We need to look at other things, other ways to manage you medically, whether it's putting you on rinses, whether it's examining you more often when you feel like when you do have a problem. I think we talked one time about the fear of the rigid endoscope. Yes. And so you got to get people used to being examined with a rigid endoscope. And a lot of times when people are saying, hey, I'm sick or my sinuses feel bad, I will show them I will put the endoscope in the nose, turn the camera around so they can actually see what I'm seeing when I look in their nose. And a lot of times just letting them visualize what's going on, it takes some of the mystery.
Right, knowledge is power.
Correct. And so I think that helps. I know if you can show them a CT scan as well, if you can show them, look, this is the picture, this is the anatomy, this is what we see in your sinuses, I think that helps them a lot as well.
So you spend a lot of time with your patients educating them prior to doing any treatment or even diagnosis.
Correct. We try to. A lot of people are a lot more sophisticated in terms of their medical understanding. They see things off the internet. A lot of times people will come in and say, hey, I think I've got this. And they'll show me their iPod or their iPhone about an article they pulled up. An interesting thing is I've had several people, when I'm examining a family member, will take their iPhone out and video me examining their relative or their loved one. And it doesn't bother me. To some extent, I think they're like, oh my gosh, look what they're doing. Look what the doctor's doing. But I do think it kind of helps them after the visit to go back and say, okay, what did the doctor do today?
Yeah. Well, I find often when you go to the doctor as a patient, you only really digest 50% of what the doctor says. I know when I go with my mom to her appointments, she hears 50% and I hear 50%. And afterwards, we try to put the two 50% together to understand, well, what a great idea. Just video it or record it. And then you don't have to recall the information. You've got it.
Right. I would not have believed that until I was a patient. And when I was a patient, I remember we were talking about my shoulder. And so I remember leaving. I had a great conversation. And I remember walking to the car and getting in the car and going, no,
wait, what?
What did the doctor say? And I do this every day. So if it can happen to me, I'm sure it can happen to anybody. So yeah, it's a matter of conversation. It's having conversations and having a sense of what people realistically really want. I mean, sometimes it's a matter of telling them, look, what you're asking, it's not really realistic in terms of what you've got. I mean, it's medicine. It's not magic. And so it's a question really of talking to people more than anything else.
So there's the process of talking and understanding the problem, you getting to a diagnosis that you believe is the best diagnosis for your patient, and then setting expectations for them going into the treatment, right? That's sort of the process.
Correct.
And then once the surgery has happened, talk a little bit about the post-surgery process and again, still managing expectations, I would think.
Yes. So to some extent, I mean, you're always listening to what your patients tell you. But the other thing, and we've mentioned this before, sometimes sinus disease is not just a question of, hey, I've got a sinus infection. Sometimes sinus inflammation or sinus problems are a manifestation of a systemic illness. Whether that illness is severe allergies, there's something called, it's a big long name, aspirin exacerbated respiratory disease, or people that are allergic to certain medications. Sometimes it's a matter of being in an environment or being in exposure, whether it's at work. I've had some people that have had significant chemical exposures and did not have surgery, but they told me, look, when I get out of where I'm spending my time with chemicals, and usually it's at work or some kind of a chemical exposure, I'm going to get better. A lot of times I've diagnosed people with or had help with a diagnosis of having immune system problems, having low immunoglobulin levels. And so you can do all the surgery in the world and give people all the antibiotics that you want to, but if they don't have an immune system that's strong enough to fight off what you're exposed to on a regular basis, you're going to have chronic problems.
Or if they live or work in an environment that is impacting their sinuses, until they change that environment, it doesn't matter all the surgery in the world.
Correct. I think you and I were talking before the show started about I had a patient who lived down here, worked down here, had terrible sinus problems. I operated on him down here, and we just had the hardest time afterwards. I mean, it was one thing. There were polyps that were reforming. The nose was chronically inflamed, and we went through everything. We went through allergy testing, and there were some allergies, on antibiotics, culture-directed antibiotics, more steroids, nasal rinses. And finally, this person got another job out of state and moved out of state and had continued to do the rinses and things like that, and came back to see me 6 months later when they were back here on some other type of business, and came in to see me and let me look in their nose, up their nose and their sinuses, and it was dramatically different.
Wow.
Nothing had changed except the environment. And so when they were leaving Mobile, they had to spend some time down here for a week, 10 days, something like that. And by the time they left, they came back to see me saying, and I kept wondering, like, okay, well, I'm glad to see you. Why are you back? And this person said, I'm sick.
Oh, wow.
And looking in the nose when they've been home for, 10 to 14 days, there were already some of those old changes that we had really battled with before they were starting to come back.
Wow.
So it's really very humbling to think that, to some extent, we don't have complete control over our bodies. And as a doctor and as a surgeon, I don't have complete control over somebody's body. I mean, we all I think every doctor wants their patients to have the best possible result and have the best outcome. But sometimes there are things that are just beyond our control.
Talk about what you do anticipate. What does surgery success look like? So a more typical, we just discussed probably an atypical case.
Sure.
But in a typical client, if there are any patients who are typical, what does success look like?
Well, endoscopically speaking, success looks like all sinuses open and clear, no swelling in there, good nasal passage airway, no inflammation, no drainage down the back of the throat. If I had to give you one adjective to describe a great outcome would be calm. The mucosa, the nose cavity is calm and quiet. Well, a lot of times when we see people before they're well, if I had an adjective to describe that would be angry. You look in the nose and everything is inflamed and it just looks angry. If I can use the word, well, there's probably a lot of words I could use to describe that, but very, very angry. And when you get the success that we like to see, it's a nice, calm, healthy-looking, normal-appearing nose, no swelling, no inflammation, and generally speaking, those people are really happy and really grateful. The old saying in medicine is the people who are the most grateful patients are the ones that can't see and the ones that can't pee. If you can help someone see better and pee better, they're happy.
So we want to get our noses from angry noses to calm noses is the goal.
That's exactly right. You want to have a happy nose.
A happy nose, for sure. Well, I do want to encourage our listeners to go back to our first season. In episode 4, we talked about when and why to do sinus surgery. And in episode 5, we really talked about knowing when it's time to have surgery. And both of those, if you have an opportunity to go back and listen to those, are very valuable conversations that lead to this one. And when we talk about setting expectations and the results and what success looks like for surgery.
Before we end the show, there was one thing I probably would touch on briefly was when we talk about sense of expectation. A lot of times people ask, and it's a very good question, is how long am I going to be down from work? Like what happens the day of surgery? And what am I going to feel like after surgery? So let's talk about that just for a second. I think the first thing is typically, down out of work a week, maybe. It depends on the kind of work that you do. I think if you're able to work at home on a computer, a lot of times people are able to work at home or they don't have to be outside necessarily in 100-degree heat. I can get people back to work usually in less than a week doing something, not necessarily spending 12-hour days or being on their feet all day. If you have a job that really is very physically demanding, I want those people to be off a week. If I have someone that has a very physically demanding job and is in an environment where they're exposed to a lot of dust, warehouses, lawn care equipment, outside stuff, if they can do it, I'd like them to take off 2 weeks. Not from the surgical standpoint, from the nasal health standpoint. We really don't want them back in that environment that we think may be causing trouble.
Yeah. You don't want them to be irritating those clean, calm sinuses that quickly.
Right. We want the sinuses to be happy.
That's right.
The day of surgery, usually, well, all the time, you don't eat or drink anything after midnight. So you come in the morning and you get to the hospital there and the nurses check in. And then you're in the preoperative area and I'll come and see them beforehand. I always see everybody before they go to sleep. When they wake up from surgery, if we've had to kind of straighten out the inside of the nose, which we do a lot of time, they'll have septal splints on the inside of the nose, little pieces of plastic that kind of hold things in place. Those are universally not comfortable. We try super hard to get those out within 24 hours. It just kind of depends on the situation. There's a lot of bloody drainage down the back of the throat, usually not out of the front of the nose, usually just down the back of the throat. So we'll tell families, you're going to have a sore throat afterwards. Some of it's from the anesthesia. Some of it's from the breathing tube that they put in. Some of it's from the drainage down the back of your throat. The other thing is, you wake up from surgery and universally you don't feel just super great after a general anesthetic. So the first 24 hours are a little rough. But after you get through that first 24 hours and people get the splints out of their nose and you remove all the kind of the clot and the crusting in there, you get people breathing better and they're happy.
Now, is that an outpatient or would that be an overnight?
Most of the time, this is outpatient surgery.
Wow.
Sometimes we do this in the hospital for a variety of reasons, but most of the time, this is an outpatient procedure. depending on the health of the individual or how far away they live, we'll admit them for a 23-hour observation, which is still, by most insurance companies, is still considered to be, quote unquote, outpatient.
Really?
But it depends on the insurance. But usually you can get people back to their houses the same day, and most of the time people are happy to go back to their own house.
Yeah. So then they, follow-up wise, I guess, come to see you within a week?
I see them the next day.
You see them the next day?
I see them the next day, and then I'll see them a week later. And sometimes I'll see a week later after that, depending on how happy their sinuses are. If they're angry and there's more work to do, then sometimes we have to be a little more vigilant in the post-operative process. The surgery is one step in a 10-step process. The aftercare is just as important as the preoperative care and the intraoperative care.
We did talk about that in episode 4. So for our listeners, if you want to hear more about, again, when and why to have surgery, Dr. Swain really talks about that it is a part of the process, that surgery is a part of the process from, again, understanding the patient needs, the diagnosis, the treatment, and certainly if surgery is required, the aftercare of the surgery.
Yes, and it's just a complicated process. I just, like everything else in life, there's a lot of times there is a quick fix, and hooray when that's the case.
Like you.
Right. But for most of us and for some of these issues, it requires a little more care and a little more insight and a little more time than anything else to get the right outcome and keep your sinuses happy.
Well, we all want to keep our sinuses happy, that's for sure. So if someone feels that they need to come meet with you and get you to look at their sinuses, how can folks get an appointment with you?
Call. I think that's the easiest thing. The direct line is 470-8823. We are trying to branch out and do some web-based appointments.
Good.
But we are trying to transition to that. And I think in the future, most of the appointments will be able to be made online. But for now, it's always nice to have the personal touch of being able to call and talk to someone and make sure that, somebody there is on the receiving end of a request for an appointment.
Well, the sinuses are sensitive, so are us humans. So to have a real person to talk to is a nice benefit in today's technology world. So I appreciate that you're doing both phone calls and online appointment making. So until next time, we will hope that you have happy sinuses.
Thanks, Stacy.
Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.